The Laity Council of the Catholic Church of the Archangels Parish, Gaduwa, in conjunction with Rochins Empowerment Foundation, has organized a free cancer screening exercise for all parishioners as part of the corporal work of mercy and to conclude the 2025 Laity Week. The medical outreach is in line with the spirit of the Lenten season. Over 200 parishioners were screened and tested for prostate and cervical cancer. And for those who needed immediate medical attention, they were taken to Medform Medical Center, Utako, for further examination and treatment. A team of healthcare professionals from Medform Medical Center, Utako, who collaborated with WEF and the Parish Laity Council, were on ground to provide medical assistance in the parish during the medical screening and examination. CTV News was also present.
Nigeria reportedly experiences an estimated 127,000 new cancer cases annually and approximately 79,000 cancer-related deaths. Cancer was therefore the area of interest for the president of the Laity Council of the Archangels Parish, Gaduwa, High Chief Rose Ima Okolo, who is also the founder and executive director of the Rochins Empowerment Foundation. The medical outreach program took place at the premises of the Church of the Archangels Parish, Gaduwa, and the targeted members of Zumutamata Catholic of the parish. It commenced with an opening prayer and a welcome remark, intimating the audience and the reason for the gathering.
Me in the church, going about, you will know the challenges anyone is having. You can have some emotional problems, around your life. Then those emotional problems or torture can now aggravate into other health challenges.
There was awareness and sensitization on the health issues that the outreach was targeting, such as prostate and cervical cancer.
Today, we'll be talking about majorly three things. The first thing we'll talk about today is about hypertension. Then briefly, we'll talk about diabetes. Then we'll conclude by talking about obesity.
So how do you know that if you don't get something, if you don't happen for your cervix as a woman? It might not necessarily, if you see all these signs, it might not mean that, you have cancer already. If you see all these signs, that means you need to go hospital, make them check and run other tests before they now confirm and say this is cancer. So as a woman who is sexually active, you're not supposed to be feeling pain when you sleep with man.
There was also a question and answer session which the doctors present handled. The medical exercise also involved vital signs and consultations with the experts. Those recommended for the screening were transported to the Medform Clinic Utako, while others who did not undergo the screening were given a self-care kit which they received joyfully. Those who needed urgent medical attention were conveyed to the Medform Hospital, Utako, where they received comprehensive treatment free of charge, courtesy of the Laity President and Rochins Empowerment Foundation.
It's good for us to do that, but you'll find out that there are people inside those structures that are dying emotionally, health-wise, and I've seen it basically in this our parish. So I decided to use my own humanitarian initiative in terms of medical outreach as our Laity corporal works of mercy. I don't want to go to other hospitals. I don't want to go to other places. I want to bring it now to tell people that it's just not buying food to give people. You should look for their physical well-being. You should also sensitize them, which is a sort of emotional well-being, and you should also run some tests and screening to them, which is health-wise, their mental well-being.
You all knew what happened here in the same church. She fed over 1,000 plus, not even feeding them, but giving them hope and giving them something to take home, to sustain at least for 1 week, 2 weeks, or 3 weeks, or thereabout. Which I witnessed. I was part of the people that bring out the sharing formula, and I gave. So I applauded her, and I also hit her the same day. Say, keep on, because I know God is taking you somewhere. I am not coming here just because she's High Chief Mrs. Rose. I am coming here just because she's touching life. So she has hit me again. And I will not cease to be praying for her day in, day and night. I want to also challenge her again. Yes, I saw what happened. Even most especially the two serious ones, which we have witnessed, the way they were attended to, immediately moved to the hospital, and even assuring us that one of them is going to be attended to the extent of having an operation. Are you see the what are we talking about? Individual. She's not managing anybody's money. She's not managing any government money. She's not in any office serving as a government officer. She's not doing the job because God has decided to touch her and that she wants to give out. Believing that the little you give out while alive is what God is going to ask you when we go over there, not the amount of money you make.
So what we wanted to do today and what we were able to achieve was to sensitize the public, sensitize the parishioners of the Church of the Archangels here in Gaduwa about the importance of doing their regular health checks, doing their prostate checks for the men from age 40 and above, and emphasizing that they need to be doing yearly checks. So age 40 and above, we also talked about common symptoms that the men can experience and what can lead to prostate cancer. So with the women, we also targeted the age group from age 25 to 65. We did some sensitization on cervical cancer and the importance of cervical cancer screening.
Cancer is one thing that scares almost everybody. Once you hear that this person is suffering from cancer, it kind of sends the person even 10 years to the grave before the person dies, assuming somebody has it. So it's a program that is commendable and should be encouraged to be always organized for people to benefit. Appreciate most especially she, the Laity Council chairperson and her foundation, with others, her committee that organized this thing, that the good Lord will continue to lead them. I pray that as she is doing this work, she is going to be guided by the precious blood of Jesus. And I believe Mother Mary will intercede for her. The experience I honestly want to share with my fellow women and men that we came here today for this test, I really appreciate, because if I were to spend, I don't know how much I will spend. But the little thing I see there, or I experience there, based on the tests which I undergo by the doctor, starting with questions and going out there to take my sample. In taking the sample, I don't want people to feel scared, because it's just a very simple thing.
In Abuja, Priska Iwendi, CTV News.